Dear Professor Van Poppel, we are very proud to have you as our honorary editor for Atena Journal of Urology, which is a journal that is patient-focused. Personally, I'm very grateful to be in the position of asking good questions, as you know very well, a while ago the roles were reversed. You are a great surgeon, and I had the chance to see it firsthand, or better said, in surgical words, as an assisting surgeon. You helped introduce the prostate cancer surgery in Europe and to popularize complex surgery for kidney cancer. You have created a school of urology for the young urologists to offer them equal access to the best medical knowledge. You have mentored many surgeons that have now become professors themselves, and you have been one of the leading personalities for the European urology for many years. I apologize, I'm sure I have missed many of your achievements, but I'll start by asking which one of your achievements would you say you are the most proud of?
Thank you, Christian. I still keep the best memories of the first time when we met, I think, at an EAU masterclass in Salzburg, and then afterwards when you were visiting my place and that you were helping me doing surgical oncological cases here in Leuven. Your question, what I'm proudest of, it's maybe difficult to really specify. I've been the director of the European School of Urology for 8 years, coordinating all the teaching of urology in Europe and beyond even. And then after that, I became Adjunct Secretary General for Education in the EAU. So I had the responsibility on the School of Urology. I had the responsibility for the guidelines, which are so extremely important. And maybe the proudest is that I've always been looking at healthcare givers, at urologists and training. And in the last years, I gave more and more attention to the patients and to patient centricity in everything we do. And I'm extremely proud that we have been setting up this patient office, a patient office for patient with patients within the structure of the EAU.
So why do you believe a patient-centered platform or structure is relevant?
Well, if you look what actually the patients today have to do or to say in the EAU, it's you cannot think about having a functioning professional association without the patients. We have patients involved in the guidelines office. There is a man sitting with prostate cancer in the prostate cancer guidelines panel. In the Congress, the EAU Congress, with 18,000 people attending, there is a patient day. There is a patient track. When we do live surgery, there is a patient sitting there to really look whether everything happens following the ethics. If you look at the school, we have courses, master classes for patients, for the normal patient, for novices, I would say, but also for advanced and for patient advocates. The achievement in the Congress is going every year more and more. So there is now, patients can submit posters. They share sessions for patients, with patients. It's absolutely amazing. And then finally, as I said, the platform is extremely well represented in the patient office. There is obviously a urologist who is chairing it. It's Eamon Rogers from Ireland, but he is now overviewing the patient information initiative. Patient information in EAU is a translation of the guidelines in a patient understandable language. It's translated in 20 languages. And there is the EPAC, which is the EAU Patient Advocacy Group, where all patient organizations like Europa Uomo for prostate cancer, the IKCC for kidney cancer, the World Bladder Cancer Patient Coalition are all members of, and not only oncology, but also the World Federation on Incontinence and pelvic pain. So patients are everywhere. It's not creating a platform. They are really part of EAU and of all the programs that we put in place.
The patients are always there. We just need to integrate them in our organizations.
Yeah, absolutely.
Professor, you are one of the world's best experts in prostate cancer. So what would be 3 pieces of advice you'd give every man and woman, not patients?
Well, if I need to give an advice, the first advice would be to the women, actually, because men do not care too much about their prostate. They ignore they have a prostate, so certainly they have no problems. So the first important message would be for the women to support their men and to make them aware that they can face problems that do not have to destroy your life, but that they have to look at themselves much more, just like females do. The second thing that men need to realize, and I'm talking about prostate cancer, but also about other cancers, this disease does not give symptoms. So have your health check when you're healthy. When you have symptoms, for prostate cancer, you know very well, Christian, it's BPH, it's the benign prostate enlargement that gives complaints. But prostate cancer, in its curable stages, does not give any symptoms. And then the last thing is that if we want to cure a disease like prostate cancer, you need to detect it early. And because it has no symptoms, you need to talk to your doctor, to your GP, to your house doctor or family doctor, and say, okay, I do not want to die from prostate cancer. Can I do something about it? And he will help you so that it can happen in the best possible way, so that you do not come too late, because if you come too late, it's a terrible disease that kills you. It's not an old man's disease that doesn't kill. It's a disease that kills men in their 50s.
Yeah, and on the same idea, what would you say a patient that was diagnosed with prostate cancer? Just some short ideas. I know it's very difficult to.
Well, the most important, I think, is that patients have the right to make a shared decision with their caregivers. They have the right to go for second opinions, for third opinions. So not just see one specialist, be it a urologist or a radiation oncologist or a medical oncologist. A shared decision where they have all the information they need to make the best decision for their quantity of life, obviously, but more importantly, for their quality of life. So good information, no fake information. There is so much fake information out there that will mislead patients and will lead them to maybe a suboptimal management of their disease. And therefore, again, we have the patient information leaflets, we have animated videos that are all available. And then one more important thing is that we have, on the long run, even if the disease is advanced, we have new treatments, and there is novel treatments coming around the corner. We have new diagnostic tools, so that even in advanced disease, we still can make that patients with prostate cancer survive, and with better quality of life than so many years ago, and with also an improvement in outcome when it comes to survival and life expectancy.
Yeah, that's definitely great news, not just for our patients, but also for us, that we have more weapons, to say so, to fight with this disease. I know that you are very actively lobbying for a change of policies to help our patients with prostate cancer. What can you tell us about it?
Well, it's very easy, and not everybody knows that prostate cancer is the most common male cancer. It's not everywhere the most common death by cancer. In Sweden today, prostate cancer is the first killer by cancer. So it kills more people than lung cancer. In most countries, lung is still the first. In some countries, colorectal is number 2. But if you see in Germany today, Death by prostate cancer is number 2. It kills more than colorectal. In the UK, prostate kills more men than women are killed by breast cancer. And nobody speaks about we're going to do something about prostate cancer and prostate cancer screening or prostate cancer early detection. So it's a non-preventable cancer. There's cancers that can be prevented. Yeah? We know lung, for instance, maybe liver, pancreas, induced by alcohol and by smoking. So it's not a preventable cancer, and it gives no symptoms. So there's only one possibility to detect it in time, and this is early detection. Call it screening. Screening has a bad name because with the screening that we have done years ago, we over-detected a number of men with cancer that was an insignificant cancer. You remember the studies on autopsies of young men that had traffic accidents and died. The prostate was taken out and they looked under the microscope. And at 70 years of age, the majority of men had microscopic cancer. So if you do too many biopsies where it is not needed, you will find cancers far too much and you will treat them, and then the patients will suffer the treatment complications. So there has been overdiagnosis and overtreatment, and therefore everybody has been against PSA testing. But today we have the tools that if your PSA is too high, we can do risk stratification and see, yeah, you need further investigation. You don't need, because you have a large prostate. You have no family history. You are not African American. You have no gene mutation. So we have a number of factors that is simply, everybody can see it on the internet. When you see risk calculator, you can calculate the risk that you have to have a significant cancer. And this is what we are lobbying for today, not to do PSA testing in all men at any age. This must be stopped, but to look between 40 and 50 years, patients at risk a little bit earlier, otherwise at 50 years, to have a check after shared decision with your GP, have a blood sample. If the blood sample shows a prostate-specific antigen, a protein that normally belongs in the ejaculate and not in the blood, when this level in the blood is too high, this might be prostate cancer. But you have to look then whether the risk of having prostate cancer is high enough to do further examinations, which is then an MRI, nuclear resonance imaging, or not. And this way we will decrease the mortality that is increasing now, because often prostate cancer is found too late. We will improve the quality of life of our men, because men are not aware. Women must actually push their men to have their health checked with the GP, as I said.
Thank you. How can we and our patients help you fulfill this personal mission and also the European Association of Urology mission of changing the European Union policies?
Well, my mission is, and I hope that we will succeed soon. You know that the European Commission, Ursula von der Leyen, has launched the Europe's Beat Cancer Plan. Yes. Now, if you take it seriously, if you want to beat cancer, if the politicians really mean it, you cannot have prostate excluded any longer. Next to cervix and breast and colorectal, there must be an early detection strategy, of which we have the guidelines. We know how to do it. And this is what we absolutely are now trying with the EAU. This is our main mission, that when in 2022, this is this year, the Commission, the Council will come up with new recommendations for early detection. We want prostate cancer to be in, and to help the European Union with the guidelines that we have available to get it in there. And the voice of the patients, again, here is so important. When we as urologists knock on the door with the politicians to say, you need to do PSA testing and early detection, they say, you are doctors, you want to do more prostate cancers, you want to treat more prostate cancer to improve yourself. And here the voice of the patient is important, because the survivors, the patient coalitions, they all know that if they are still there, it's because at a certain point in time, they had their checkup and their early diagnosis so that they could be treated in a decent and curative way.
Yeah, it makes absolute sense. And I really hope that you will succeed in changing that policy. I know we are talking about a patient-centered platform, but I can't stop me asking you, what would you tell to the young 25 years old Van Poppel? What advice would you give you?
Yeah, well, you know, surgery has been my life, but I realized that urology is a specialty that is destroying itself every day. If you look back at the history, we started by doing varicoceles on every boy that had on the Valsalva maneuver, a little swelling of his scrotum. And then we stopped doing it and said it's maybe not needed first. And if you need to treat it, you do an embolization. So finish the surgery. The stones. We invented and introduced the stone smashing machines, the ESWL. Finished all the very nice stone surgery that we did before. For cancer, it's the same. We are now saying that you do not need to operate on prostate cancer under certain conditions. We do active surveillance. We are always looking at other modalities. And the more we can avoid patients to need surgery, the better it is. And what I would say to the young urologist, be careful. Urology is not only surgery. There will be less and less surgery. And there will be more and more medical treatments and non-invasive treatments, focal treatments, where other specialties will come in. And this is where your interest should go to. Obviously, the robot and surgery, it's fancy. And this attracts people to urology. But be aware that medical urology is going to get more and more important. So if you want holistically treat patients with cancer, don't forget that surgery will not remain the most needed and the best treatment that patients can have. So be interested in drugs. Be interested in radioligand therapies that are upcoming, that we hopefully in the years to come will introduce. Be interested in radiotherapy, medical treatment, medical oncology. I think this is, urology is not only surgery. That would be my message to the youngers.
And any other advice you'd give to the young doctors, how to become better professionals? Also thinking about patients now.
How to become better professionals, it's the multidisciplinary collaboration. This is what we absolutely need. And you know that we have these multidisciplinary teams. And in Leuven, from time to time, we have patients involved. This is not the regular patient, this is patient advocates that can come and follow how these multidisciplinary teams work. There is no mono specialist any longer. It's not because you're working in a small hospital, you can connect with anyone. You need to work in multidisciplinary teams. This is absolutely mandatory.
Professor, thank you very much for your time. And I hope that you might accept another interview in the future that will be more focused on prostate cancer, and especially prostate cancer for patients. Thank you.
It will be my pleasure, Christian. I think that your initiative, Atena, a patient journal, is absolutely a great initiative. And I'm happy to lend support, and be sure that I'm really very honored to be honorary editor for the Atena Journal. Thank you so much.
Thank you very much, Professor. Thank you.